Hey everybody, this is Dr. Monica Du. I wanted to talk with you all today about a very serious problem that many of our children face. I'm sure you know someone with asthma. Now, asthma is oftentimes a chronic lung disease that causes lots of airway narrowing or bronchoconstriction, bronchospasms. That bronchial airway, the lower airways, is just not very open and compliant. It is often filled with mucus and just very hyperreactive. Another term that you might hear it classified as hyperreactivity or reactive airway disease. It is something that can definitely be a hindrance in children's lives. They are oftentimes, those wheezers, that high pitched inspiratory sound that you might hear when someone is having an asthma attack, like that's what you might hear. And it can cause chest tightness. It can cause someone to just feel short of breath and make them just feel like they just can't get an air in. A very unpleasant and even very scary experience, especially for a child. So I'm sure you know of someone, whether it's your child or a family member, a friend, that has suffered with this disease. So today I just kind of wanted to go over some very important tips about asthma, what it is, the control of it, and when a specialist needs to be involved so that we can prevent fatalities that can occur. People can actually die from this disease, and I have seen it happen to a little girl, a few years ago. She just happened to be at home. She was on asthma medications. Seems like she was feeling fine. Her mom came home and she told her that she was just feeling a little bit short of breath, and she said, okay, you know what, just rest a while up in your bedroom, and then I'll come check on you. And unfortunately, shortly after that, they found her unconscious. She was actually having an asthma attack, and they were not able to recognize it, and it was too late. So that's why I wanted to share this with you. It's so important to be able to recognize the signs of distress, which is often going to be associated with that chest tightness, wheezing, sometimes chest pain, not feeling right, especially if they are having physical activity, rigorous activities. It can sometimes come on at that time, but it can also be triggered by many other things. For example, pollen in the air, many other allergens, dust, mites, dogs, cats, cigarette smoking. I got to tell you, that is a big one. Some people think, oh, I smoke outside the home, but guess what? All that particles from the cigarette is still on your clothes, it's on your skin, it's in your hair. So even if you smoke on the outside, or some people say they put a jacket on, it's not enough. Honestly, to tell you the truth, you have to avoid it altogether for someone, especially that is an asthmatic person, because it can cause reactivity in their lungs and cause them to have an asthma attack. Now, of course, we want to do all that we can to prevent flare-ups and asthma attacks. So one of the main things is to make sure that we avoid the triggers that can cause a flare-up. So basically, what do we do? What kind of medicines do we usually give if someone is having an asthma attack? Rescue medicine is going to be your albuterol. And that is basically a bronchodilator that causes those narrow airways down below to open up and be able for them to get more air in. That is one of the major medications that is given as a rescue medicine to help. Now, we hope that your child won't have to use this medicine regularly. If they are using this medicine every day, every week even, that is too much. We hope that it would just be used on an intermittent basis, maybe every now and then. if they had like a URI symptom, and sometimes it can progress and set in their chest, maybe they may have to use it every now and then, even once or twice a year. That would be ideal situation for someone with asthma that just has intermittent flare-ups. But we don't want them to have to use it all the time. And it's so important for us to understand that our rescue medicine is not supposed to be used for someone with runny nose and congestion if they are not having associated wheezing or shortness of breath, chest tightness with that. If we use it too much, it can become non-effective, for example, in an emergency situation, because our body has become used to it. And it's as if you're not given much of anything. So it's so important to know when it is to be used. I hear it all the time. Oh, I give it to her every now and then, every day, if she has a runny nose. So, well, that's just too much then. And that may indicate that her symptoms or his symptoms are not under control. Now, there is a classification system that physicians will use to kind of guide us and help us to understand what the severity is of the asthma. It ranges even from intermittent, mild, moderate, all the way up into severe. Now, if someone is intermittent, most of the time they'll just need that rescue medicine, that albuterol. However, if they're going up the ladder of severity, they may need something called a controller medicine. Very different from the rescue medicine. Your controller medicine is going to be usually some type of steroid medicine that can be given through a puffer, or it can be given through a nebulizer. Just depends on what the physician decides to prescribe. But steroid medicine just helps to kind of keep the airways nice and compliant, and decreases all that mucus that can build up as a baseline in those with asthma. So that controller medicine, another important thing, is supposed to be used every day, not every now and then. You have to really be regimented. And I do hear this also. Parents may sometimes say, oh, I kind of just let my child administer the medicine and hope that they'll do it each day. But honestly, now they're children, and they are not really into making sure that they take their medicine. So sometimes I see it happen. There's medicine days that are skipped, and guess what? That might lead to a flare-up. So really, as a parent, keep an eye on the children. I honestly would recommend that you ensure that they take the controller medicine if they need it. If they need a controller steroid medicine, make sure that you are there ensuring that they take it, because we don't want to regret anything. We want to make sure that they're safe and happy and healthy and live long, productive lives. But like I said, asthma can lead to fatalities. So that's why it's so important to make sure you follow the guidelines as given by your physician. And if ever you feel concerned about the medicine, you have a question about something, maybe you feel like, maybe my child doesn't need it as much anymore, don't stop it on your own. Have a doctor's visit and discuss it with them so that you all can do a safe and guided plan. Because it doesn't have to be a forever medicine, hopefully, but if it's needed, it should be given. So that's kind of the gist of what I wanted to go over today with regards to asthma. Understand that it can be life-threatening. Hopefully physician and you can decide on a plan that will keep your child safe and protected, but just be aware, rescue medicines are just for that. It's rescue. It's not to be given every day. And controller medicines are to be used to help maintain control so that your child won't have a severe flare-up or attack. All right, please do post any questions if you have any, and definitely share with your friends. This is a serious health concern, and millions of children face it daily, and I just hope that we can take steps together to prevent anyone else from succumbing to this illness. All right, you all have a wonderful day.